Just a temp nurse. That's what Dr. Sterling said when he saw Rachel Torres moving through Mercy General's pediatric ICU at 0547 on a Tuesday morning, 11 weeks into a position that was supposed to last 3 weeks. He didn't say it to her face. He said it to the residents trailing behind him like remoras following a shark, his voice carrying the particular contempt reserved for people the hospital paid hourly. She heard it anyway. Everyone heard it. The fluorescent lights hummed their institutional song above linoleum that smelled like antiseptic and something else underneath, the metallic ghost of 1,000 spills. Rachel had learned to identify that smell in Major, where hospital meant attent and triage meant standing in blood up to your ankles deciding who got the last bag of O negative. She pushed a medication cart past the observation window without changing her pace, her dark eyes tracking the monitors behind her, heart rates, oxygen saturations, the small mechanical voices of machines keeping 8-year-olds breathing. One of the patients, Tyler in bed 4, was new. She hadn't seen him arrive, but she recognized the particular silence that came with paralysis. The kind of silence that meant a child would never run again. Major Garrett sat in the visitor's chair beside the bed, his Special Forces uniform still creased despite the 17 hours he'd spent in the emergency department. His hands were folded in his lap with the kind of precision that came from 3 decades of controlling variables, of planning, of knowing that the right decision at the right moment could save lives. But he couldn't control this. Rachel saw it in the way his jaw worked when he thought no one was looking. His son Tyler lay motionless beneath a hospital blanket decorated with cartoon trucks, too young to understand why his legs wouldn't answer. Too young to remember the moment the SUV folded like wet paper when the drunk driver crossed the center line on I-405. Rachel didn't linger at bed 4. That wasn't the job of a temp nurse keeping her head down. That was the job of someone with a name tag that stayed beyond the paycheck, someone who built relationships with families and fielded questions she could never answer. She moved to the supply station, her movements efficient, unremarkable, exactly the opposite of the way her hands moved when she was threading a 24-gauge angiocath into a pediatric radial artery one-handed while stabilizing the child's wrist with the other. That took 4 seconds. The charge nurse, Melissa, had timed her once. Nobody else had noticed. Rachel had changed the subject. Dr. Sterling arrived at precisely 0600, as he did every morning, his white coat pressed to creases sharp enough to draw blood. 31 years at Mercy General. Chief of Neurology. His reputation built on a philosophy that had kept the hospital's malpractice insurance rates the lowest in Oregon, risk aversion. Don't attempt what might fail. Document everything. Recommend options that had survived 1,000 lawsuits. The hospital loved him for it. The insurance company sent him a Christmas card shaped like a bell curve. He had never lost a case because he had never taken a case that might be lost. The residents appeared like satellites in orbit, 5 of them, all carrying tablet computers and the particular exhaustion of 72-hour shifts. Sterling moved through the ICU as though walking through a museum of his own design, each patient a monument to the wisdom of the conservative approach. He stopped at bed 4. Major Garrett stood, muscles tensing beneath the uniform fabric. The 2 men made eye contact in that way that men trained to command often did, a brief acknowledgement of hierarchy that lasted exactly 2 seconds. Major, Sterling said. The CT scans show a complete T6 compression. Fracture dislocation with the spinal cord pressed against the vertebral bodies. He paused, letting the weight of the words settle. In cases this severe, surgery would likely cause more damage than the injury itself. We'll manage with conservative treatment, pain management, rehabilitation. Physical therapy has remarkable outcomes these days. Remarkable outcomes. Rachel heard it from the med supply room, where she was counting gauze pads with the kind of focus that let her hear everything. Remarkable outcomes was hospital code for the patient won't walk again, but we're comfortable with that. She didn't turn around. She kept counting. 48. 49. 50. You're certain there's no surgical option? Major Garrett's voice was steady, the voice of someone accustomed to disagreement. No procedure that could. I'm certain, Sterling said. The certainty in his voice was like a tank idling in a garage, present, powerful, final. My recommendation is to focus on the child's psychological adjustment. That's where the real challenge lies. He moved to the next bed before Garrett could respond, his residents trailing obediently. Rachel watched them go through the interior window of the supply room, watched Sterling's white coat disappear down the corridor like a flag of truce being retreated. She finished counting the gauze pads. 53 total. 3 packages opened but not used. She made a note on the tablet, her handwriting precise and small, the kind of handwriting that belonged to someone who had learned to document everything because documentation was the only thing that could protect you later. She was hanging a fresh bag of normal saline on Tyler's footpole when Dr. Sterling's resident, a second-year named Chen, sharp eyes, the kind who paid attention, positioned himself beside her, pretending to check the foresight. That compression, Rachel said quietly, her voice barely above the ventilator's mechanical whisper. T6 with dislocation. I've seen similar patterns in forward operating bases. High-velocity injury, cord contusion but not complete transection. She adjusted the drip rate, watching the fluid cascade. Decompression within the first 72 hours can reduce permanent deficit progression. Laminectomy with anterior vertebral body realignment. The technique I learned in Major at the forward surgical team, they reduced spinal cord compression using a modified balloon catheter approach to restore the canal diameter before formal fixation. Chen stared at her. Not at the four. At her. His eyes moving across her face as though recalibrating what he was seeing. You learned that, where, he said. Rachel finished with the drip rate and moved to document the time on the patient's chart. Just something I read. Old surgical journals. Probably not applicable here. The attending knows the current protocols. She didn't look up. The skill of not looking up was harder to learn than the surgery itself. Make sure that bag runs out before the shift change. She was at the medication station 15 minutes later when Sterling appeared, his white coat moving like a sail, and Chen walking 2 paces behind him wearing the expression of someone who had just reported a conversation he probably shouldn't have. The medication station sat in the center of the unit, open sight lines in all directions. 37 staff members and family members within visible range. Rachel continued preparing the morning medications with the kind of focus that suggested she had heard nothing. Sterling stopped beside the station. His presence made the air pressure change, the way some people's arrival altered the room temperature. I hear you have some thoughts on Dr. Reeves' case, Sterling said. He wasn't looking at her directly. He was looking at her the way a photographer might look at a subject before deciding whether the image was worth developing. The 8-year-old. Tyler. Rachel did not look up. She was drawing back the plunger on a syringe, measuring out 0.5 milliliters of ceftriaxone for a 3-year-old with meningitis. The measurement required absolute precision. Her hand was steady as a surgical laser. I mentioned a technique, she said. Her voice was careful, measured, deferential. Just something I'd read about. The attending surgeon has far more clinical experience. Here's what I know about temp nurses, Sterling said. His tone had shifted, become something thinner, sharper, like a blade being honed. They arrive with minimal training, maximal confidence, and a fundamental misunderstanding of hospital structure. They believe they know better than the physicians who spent a decade in training. And then they either quit within 7 days because they realize they're out of their depth, or they become liabilities. He paused. He was smiling. Rachel could see it in her peripheral vision, that particular kind of smile that didn't involve the eyes. Tell you what. I'll make you a wager. You stay here at Mercy General for 1 week. Full-time, no escaping to other units. Work alongside the neurology team. And if you're still here after 7 days without realizing that temp nurses don't play doctor in my department, I'll give you $100. Cash. How does that sound? The medication cart sat in front of her. The syringes were arranged in precise rows. The fluorescent lights hummed their eternal song. In the ICU behind her, machines beeped and hissed, keeping children alive in measured increments. Rachel capped the syringe. She turned. She looked directly into Sterling's eyes, and when she did, something shifted, something in her posture, in the precise way her shoulders aligned, in the depth of her gaze. For just a moment, the person behind the temp nurse uniform became visible. Not fully. Just enough. She took one measured breath. The kind of breath taken before something important. "I've picked up pieces of better men than you," she said quietly. The words hung in the air like a suspended scalpel. Her voice had been steady. Her eye contact had not wavered. Around the medication station, two nurses suddenly became very interested in their own tasks. A resident turned away. Sterling's smile did not change, but his jaw tightened, just barely, just enough to indicate that something had not gone according to his calculations. 7 days, he said. Then he turned and walked away, his white coat trailing behind him like a wound that wouldn't close. Rachel stood motionless at the medication station, her hands resting on the cart. From bed 4, she could see Major Garrett's hand on his son's shoulder, the paralyzed child staring at the ceiling with the confused expression of someone who was still processing why his body had stopped listening. She could see the faded unit patch sewn inside the jacket hanging in her locker, the one from the unit she wasn't supposed to have survived. The one they declared KIA to protect an operation the government still wouldn't admit happened. She picked up the syringe again. Her hands were steady. They were always steady now. It was the rest of the world that couldn't seem to hold still. What happened next in Mercy General's pediatric ICU would change everything, but nobody in that moment could have predicted it. The neurology team convened around Tyler Garrett's imaging at 8:11 a.m. on a Tuesday, and what they saw was what they always saw: impossible. For board-certified neurosurgeons, 2 fellows, and a department chief who'd spent 32 years perfecting the art of saying no. The spinal compression at T6 wasn't clean. It wasn't a simple fractured vertebra or a burst disc that could be lifted away. The car accident had fragmented the bone itself, scattered the pieces like shrapnel through the spinal canal, lodged them against the neural tissue with millimeter precision. To remove one fragment risked severing the nerve bundle entirely. To leave them meant progressive paralysis, ascending loss of function, and eventually respiratory compromise as the damage climbed toward the cervical spine. Dr. James Whitmore, the lead neurosurgeon, pulled up the sagittal view on the monitor and turned to Major Garrett, who stood beside his son's hospital bed wearing a uniform despite being on emergency leave. "There's nothing we can do surgically," Whitmore said. The words landed like a judge's gavel. "The risk exceeds any potential benefit. We'll manage the pain, prevent infection, and monitor for further deterioration. Physical therapy can begin once his condition stabilizes." Major Garrett's jaw tightened. His hands, the ones that had rappelled from helicopters and held position under fire, looked suddenly too large for the hospital room. He nodded because soldiers nod when given orders, even orders they don't accept. Tyler, paralyzed from the waist down, watched his father's face and said nothing. Rachel saw the scans during her 2 p.m. break, pulling them up on a shared workstation in the break room where the fluorescent lights buzzed their relentless hum and the coffee was always 12 hours old. Dr. Chen, a first-year resident barely older than the interns, had left the imaging open on the computer, and Rachel's finger traced the T6 compression while 2 other residents scrolled through their phones. The fragmentation was severe, yes. The proximity to the neural tissue was tight. But the arrangement of the fragments followed a pattern she recognized from field medicine in Marja, where she'd extracted shrapnel from a Marine's lower back with nothing but a combat medic's training, steady hands, and the certainty that hesitation killed faster than error. There was a decompression approach, a laminectomy adapted for cases where traditional access would cause more damage than the injury itself. You didn't remove all the fragments. You removed the right ones, in the right sequence, from a posterior approach that preserved the neural bundle. It was delicate. It was dangerous. But it was possible. You could try a modified posterior decompression, Rachel said quietly. Selective fragment removal, preserving the dural sac. I've seen it work on cases with similar fragmentation patterns. Dr. Chen looked up from his phone. The door was already opening. Dr. Sterling filled the doorway like a pressure system, his white coat pristine, his expression the particular blend of superiority and contempt he reserved for people who didn't have medical degrees. He stepped inside and closed the door behind him. He picked up the scan from Rachel's hands, not asked, took, and held it up to the light. Miss Torres here thinks she knows more than 4 board-certified neurosurgeons, he announced to the residents, his voice carrying the tone of someone sharing an amusing anecdote at a dinner party. Tell you what, sweetheart. I'll bet you $100 you quit within a week when you realize temp nurses don't play doctor at Mercy General. He dropped the scan on the desk. The residents found their phones very interesting. The break room smelled like old coffee and antiseptic wiped down, and the silence stretched like pulled taffy. Rachel took one measured breath. 1. Her left eye produced a single tear, and not from fear, never from fear, but from the precise physical reaction her body had learned to produce when rage met absolute restraint. She wiped it with her index finger without breaking eye contact with Sterling, and when she spoke, her voice was steady as a surgical laser. I've seen doctors work, she said. I've seen people who save lives. They're not always the same. She stood and walked past him toward the door, moving like someone who had already survived worse than $100 insult, which she would continue to. Sterling's face reddened, but she was already in the hallway. The next day, the cafeteria was full of the smell of reheated chicken broth and the soft percussion of 100 conversations that stopped the moment Dr. Sterling approached Rachel's table. She sat alone, as always, eating soup from a bowl that steamed gently. He reached across the table, didn't ask permission, just reached, and knocked the tray to the floor. The bowl shattered on tile. Soup spread like a stain. Chicken pieces scattered. The clatter silenced 20 conversations instantly. Sterling dropped Major Garrett's son's chart at her feet, hitting it with enough force that papers scattered across the floor. Pick that up, sweetheart, he said, his voice pitched to Carrie. Or is bending down beneath your expertise too? He smiled. He was smiling. Rachel knelt, not because she was broken, but because the chart was there and the chart contained information about a child who was losing sensation in his chest, and wiped the soup from the pages with a napkin. Her hands were completely steady. She stood and handed the chart back to him, and what she said next came out like a statement of medical fact, like a suture technique she was explaining to an intern. I've picked up pieces of better men than you. She walked toward the dish return before he could respond. Behind her, the cafeteria remained silent for exactly 15 seconds. Then conversations resumed, but something had shifted in that silence, a recognition that this particular temp nurse did not bend the way temporary people bent. 2 days later, Rachel assisted in a routine appendectomy, not assigned to the case, just observing, which was all a temp nurse was permitted to do, and a visiting trauma surgeon from the 160th saw Night Stalkers, a major who'd spent 8 years flying combat missions and then decided to retrain as a general surgeon, watched her hand instruments to the scrub tech. She wasn't sterile, couldn't touch the patient directly, but she anticipated. She knew what would be needed 3 steps before it was asked. When the appendix perforated and unexpected bleeding began, Rachel quietly mentioned a specific tie-off technique, a variation on a knot she'd learned in Kandahar. The major's hands froze mid-suture. After the surgery, in the scrub room where the skin disinfectant smelled like strong alcohol and possibility, he stared at her while she turned off the water. "Where did you learn to tie off bleeders like that?" he asked. Rachel turned off the faucet and reached for the paper towel dispenser. "YouTube," she said, and left. But the major kept watching the doorway where she'd been, his expression the particular mix of confusion and recognition that came when someone who had survived war in your exact same capacity revealed themselves without meaning to. Rachel had learned long ago that the people who truly knew what you'd done could always see it, no matter how carefully you tried to hide. But that wasn't the worst part. That afternoon, Tyler Garrett's oxygen saturation began to drop. 89%. 86%. The ascending paralysis had continued its climb up his spinal cord, now affecting the muscles that controlled breathing. Major Garrett called the charge nurse. The charge nurse called neurology. Neurology called Dr. Sterling, who ordered a full specialist panel consultation for Monday, 3 days away, and explained to the major with the patience of someone repeating information to someone not quite bright enough to understand that Mercy General operated on evidence-based protocols, that the hospital's insurance protocols required consensus on high-risk pediatric cases, that rushing into unproven surgical interventions was precisely the behavior that got hospitals sued and nurses fired. When Major Garrett pressed, when a Special Forces officer with command experience over 38 soldiers tried to give orders to a hospital administrator, Sterling simply smiled and repeated the same phrases: protocol, insurance, evidence-based, liability. The words landed like weapons designed specifically to disarm military officers, because in hospitals, the ranking system was different. Rank meant nothing. Credentials meant everything. Rachel overheard this outside the ICU. She was changing a line in a neighboring room, and the voices carried through the wall in that way hospital voices always did. By evening, Dr. Sterling had made 4 phone calls. First, to the hospital board president, Dr. Raymond Weiss, mentioning concerns about scope of practice creep from a temporary employee and the liability exposure of a high-profile military family with unrealistic expectations. Second, to the staffing agency that placed Rachel, inquiring about her previous placements and that curious 6-year gap in her CV between her last position and her current assignment. Third, to his golf partner, an investigator with the State Medical Board, suggesting a routine chart review of the pediatric ICU might be warranted. Fourth, to risk management, recommending Rachel's patient assignments be restricted to observation only pending credential verification. By morning, a new assignment sheet appeared. Rachel's name was removed from Tyler Garrett's care team. When she asked the charge nurse why, she received the hospital's version of silence: it came from administration. No explanation necessary. Rachel watched from the hallway as Tyler's oxygen saturation hovered at 86%, as his breathing grew shallow, as a child who had been completely healthy 72 hours ago lost the ability to fill his own lungs. Dr. Sterling passed her in the corridor, his voice carrying the particular satisfaction of someone watching his strategy work. "Policy exists for a reason, Miss Torres," he said. "Patients deserve qualified care." His smile was perfect. His white coat was perfect. His certainty was the kind that came from 20 years of being right in an institution that had taught him that being right meant being untouchable. Rachel's hands curled into fists at her sides, her nails cutting small crescents into her palms, but she said nothing. She had learned that sometimes the most powerful response was the one that didn't sound like anything at all. The monitor alarm began as a whisper at 3 in the morning. Then it became a scream. Rachel was in the supply closet on the 3rd floor when she heard it, that particular cadence of the pediatric ICU's oxygen saturation alarm, the one that meant the numbers were falling faster than the system expected. She knew that sound the way soldiers know incoming artillery. She knew what it meant before she knew whose room it was. She moved toward the stairs instead of away, muscle memory overriding the logic that had kept her quiet for 6 months. The stairwell smelled like old fluorescent bulbs and industrial cleaner, that particular antiseptic tang that hospitals never quite wash away. Tyler Garrett's monitor showed 82% and dropping. The numbers scrolled downward like a countdown nobody wanted to watch. 80. 78. 75. The overnight resident, Dr. Patel, stood at the bedside with his hands moving but his eyes uncertain, a young doctor trained for textbooks, not for 8-year-old boys turning the color of old bruises. Major Garrett stood on the opposite side of the bed, his hand on Tyler's shoulder, the only part of his son's body that still responded to the world. The boy's breathing had changed. It wasn't the deep, even rhythm of sleep anymore. It was rapid and shallow, like a bird's chest heaving in a cage, like lungs trying to work with muscles that weren't listening anymore. "I'm calling neurology," Patel said, his voice cracking at the edges. "Dr. Williamson should be here in 40 minutes. 40 minutes. Rachel understood the mathematics of ascending paralysis the way other people understood gravity, as something inevitable, as something that obeyed physics too simple to argue with. The compression was advancing upward from T6 toward T4, toward T2, toward the intercostal nerves that controlled the muscles between the ribs. When it reached that high, when it suffocated those nerves the way a hand suffocates a flame, Tyler's diaphragm would begin to fail. His body would forget how to breathe on its own. 40 minutes was generous. 40 minutes was a prayer. She appeared in the doorway because appearing quietly had become her default. Nobody noticed her until she was already there, until she was already part of the room the way shadows are part of corners. "Get out," Patel said, not even looking at her. Dr. Sterling left explicit orders. "You're not assigned." Rachel ignored him the way you ignore a sound that doesn't matter. She moved to the monitor, reading the waveform the way other people read faces. The oxygen saturation climbed back to 84, then dropped to 81. The pattern told her everything. The numbers told her that the boy's lungs were working twice as hard as they should have to move half as much air. The pattern told her that something upstream was dying. She pulled up the spinal imaging on the computer terminal, her fingers moving across the keyboard with the kind of certainty that came from muscle memory, from 1,000 hours in field hospitals where the choice was fast or dead. The scans bloomed across the screen in grayscale, the compression visible at T6 like a fist closing around the spine. But it wasn't static. The spinal cord itself showed that telltale swelling, that edema that meant the compression was active, advancing, a slow strangulation in real time. "You need to leave," Patel said again, louder this time, but his voice had already given up. He was young enough to believe in authority. He wasn't old enough to know that authority meant nothing when a child was dying. Major Garrett's eyes met Rachel's across the bed. In that moment, across 8 feet of hospital room and 7 months of her playing a temp nurse, she saw a man who had commanded soldiers in places where command meant the difference between breathing and not breathing. He saw a woman who was looking at his son scans the way a wolf looks at terrain it knows by heart. "Can you save him?" His voice was steady as a gun barrel. "Tell me the truth." Rachel didn't break eye contact. "Not legally." The major nodded once, a small movement that contained entire wars. "But can you save him?" The nurse anesthetist stood at the head of the bed, bagging Tyler manually, one hand working the ambu bag with the steady rhythm of someone who had done this 10,000 times. Her name was Chen, a woman in her early 60s with gray streaking her dark hair and hands that moved like they'd seen everything the world could throw at them. She'd worked trauma units from San Francisco to Denver, the kind of hospital floors where people came to live or came to die and there was rarely anything in between. She was watching Rachel with an expression that had moved past professional concern into something else. Recognition, maybe. The way you recognize a specific kind of danger. Rachel turned to her. "Can you maintain sedation without an attending present?" Chen didn't answer immediately. She looked at Tyler's monitor. She looked at the boy's shallow breathing. She looked at Rachel's hands, at the way they hung at her sides with the kind of stillness that only came from learning how to be still while everything around you was falling apart. "I've worked a lot of floors," Chen said finally. "With a lot of nurses." She adjusted the ambu bag, pushing air into lungs that were beginning to forget their own function. "You're not just a nurse." Rachel pulled on sterile gloves. The latex snapped against her wrists like a trigger being pulled. The sound was sharp, immediate, a small violence that meant the next part was already beginning. "Lock the door." Major Garrett moved to it without hesitation, his special forces training converting instantly into civilian action. The lock clicked. Behind that door, in a room on the 3rd floor of Mercy General Hospital in Portland, a child's life was going to come down to hands and knowledge and the kind of composure that only came from having already survived worse. Rachel pulled the sterile field across the small table beside Tyler's bed, her movements precise as machine work, each placement exact because precision was the only thing standing between breathing and not breathing, between waking up and becoming one more absence in the world. Patel stood frozen, understanding finally that he was watching something he hadn't been trained to watch, something that his medical school had prepared him for by showing him textbook pictures of it. The real version looked different. The real version had hands that moved like they were playing an instrument nobody else could hear. "What are you doing?" Patel's voice was small now, the smallness of someone realizing that protocols were written by people who'd never stood in a room with an 8-year-old boy whose body was forgetting how to live. Rachel didn't answer. She didn't have time for the language of permission. She was already moving past the part where she explained herself, past the part where authority mattered, into the part where the only thing that existed was the spinal cord compressed at T6 and the nerves that were suffocating inside it, and the technique that she'd learned 6 years ago in Major when a SEAL named Gator had taken shrapnel through his thoracic spine and had exactly 8 minutes before his diaphragm stopped working. Tyler's oxygen saturation read 79%. The numbers were still dropping. The clock was still running. And Major Garrett stood by the door with his hand on the lock and his eyes on his son's face, watching a woman he'd never met before save the only thing in the world that still mattered. Chen kept bagging. Her hands didn't shake. She'd learned a long time ago that trembling was a luxury that people with someone depending on them couldn't afford. The monitor's alarm screamed like wounded animals. Oxygen saturation 82. Then 80. Then 78, and falling with each shallow breath Tyler managed to pull into his lungs. The ascending paralysis had reached T2, 2 vertebrae from his respiratory center. 2 vertebrae from the point where his own body would forget how to breathe. Rachel stood at the bedside, watching the numbers collapse on the screen. The ventilator was already running, but Tyler's own intercostal muscles were failing, the paralysis climbing his spinal cord like a thief stealing functions he needed to stay alive. She'd seen this progression before. In Major, it took 17 minutes. They'd lost that patient in a field hospital tent with no proper imaging and hands that were learning as they worked. Tyler had access to everything and nothing at the same time, equipment that cost more than a house, sitting useless because the doctors who could authorize treatment had decided he was inoperable. She picked up the bedside phone and called the on-call resident. Dr. Patterson answered on the third ring, voice thick with sleep. Tyler Garrett's paralysis is ascending, Rachel said. T2 now. He's compensating with accessory muscles, but that window is closing. A pause. She could hear him pulling up the chart on his phone. He's attending her standing orders, Patterson said. Case is too complicated. No emergency decompression without. Without what? Rachel's voice was level. Permission from Sterling? He's not answering. I've called twice. Then we wait until he does. She hung up. The next call was to the hospital operator asking for Dr. Sterling's emergency line. His voicemail picked up on the fourth ring. She left a message. Short, clinical, professional. Dr. Sterling, this is Rachel Torres in the pediatric ICU. Tyler Garrett's ascending paralysis has reached T2. Oxygen saturation dropping despite supplemental ventilation. Recommend emergency decompression laminectomy to relieve spinal cord compression at T5, T6. Please advise. She left her callback number and hung up. The monitor beeped. 75% oxygen saturation. Rachel stood still for exactly 10 seconds. She'd learned that trick in Kandahar, when the world was moving too fast. 10 seconds of stillness could sharpen everything. In those 10 seconds, she thought about protocols. She thought about scope of practice and hospital policy. She thought about a boy who would spend the rest of his life paralyzed from the waist down because the people with authority had chosen caution over his future. She thought about what disappeared when you followed rules written by people who'd never held someone's life in their hands and felt it slip away. At the base of the pediatric ICU, there was a crash cart with a trauma pack. Inside that pack was equipment most pediatric nurses never touched, surgical instruments that belonged in an operating room, not in an ICU. Rachel had packed that cart herself during her third week, recognizing what most people missed. The instruments were old, well-maintained, the kind you kept for the impossible moment when protocol became a luxury you couldn't afford. She found Nurse Chen at the medication dispensary and lowered her voice. I need you to pull pediatric sedation. Midazolam, succinylcholine for RSI. And get the anesthesia cart. Chen's eyes widened. Why? Because Tyler's running out of time and no one with a title is answering their phone. Chen didn't move. She was a good nurse, the kind who understood procedures existed for reasons, who believed systems worked if you waited long enough. He's 8 years old, Rachel said quietly. And he's going to die if we wait. Chen was moving before Rachel finished speaking. She'd seen enough in 23 years of nursing to recognize the difference between a rule and a death sentence. Rachel returned to Tyler's bedside. Major Garrett was in the chair beside his son's bed, his uniform jacket draped over the armrest, his face carved from exhaustion and something worse, the particular agony of watching your child slip away one breath at a time. He'd been asking questions all week about the decompression procedure. Rachel had explained it in careful detail, knowing all the while that Sterling had decided it was impossible. "Major," she said quietly. He looked up. His eyes were red-rimmed but alert. "I'm going to relieve the compression on Tyler's spinal cord," Rachel said. "Right here. Right now. In the next 40 minutes. I'm going to perform an emergency laminectomy." Major Garrett sat very still. "You have authorization?" "No," Rachel said. "But I have capability and your son is running out of time." He nodded once, the way men nod when they're watching someone choose something irreversible. The work was mechanical. Muscle memory didn't feel, it just executed. Rachel had done variations of this procedure in tents and hums and a fortified compound outside Major where the operating table was made of plywood and duct tape. The equipment here was clean. The lighting was precise. The difference between a field surgery and this was the difference between surviving and surviving whole. She prepped Tyler's lumbar region with sterile technique, her hands moving with the confidence of someone who'd made this incision more times than she could count. Chen pushed the sedation, imidazolam first, then succinylcholine to paralyze the muscles. The breathing tube was already in place. The ventilator took over completely, inflating lungs that no longer remembered how to work on their own. The scalpel made its first incision at 0315 hours. The smell of antiseptic and blood rose in the small room. Rachel's hands were steady, the kind of steady that comes from having already accepted the worst and moved forward anyway. She exposed the laminae of T5 and T6, the bony structures that protected the spinal cord and also compressed it. The rongeur fit perfectly in her palm, the familiar weight of it like meeting an old name. She worked with the precision of someone extracting shrapnel from a living thing, clearing fragments of bone and the hematoma that had accumulated around the compressed nerve tissue. The spinal cord beneath was pale, swollen, crushed. It was also still viable. She could see the color of it, the texture. It could still recover. She cleared the compression with the meticulous care of a person working against time that wasn't infinite. "O2 sat?" she asked. 88, Chen said. Rising. 92. 95. The numbers climbed like a prayer answering itself. Rachel closed the incision with the kind of precision that made it look simple, subcuticular closure, each suture spaced exactly 2 millimeters apart, the tissue coming together as if it had been waiting to be whole again. 97% oxygen saturation. 84 beats per minute. The monitors showing a child whose body was remembering how to survive. She was removing the drapes when the door opened. Dr. Sterling stood in the doorway in his street clothes. He'd dressed in the car, come straight from wherever he'd been at 3:56 in the morning. His eyes went to the surgical field, to Rachel's gloved hands, to his patient lying anesthetized under lights that were never supposed to shine on an operating table in an ICU. His face went white first. Then the color came back, flooding into his cheeks like rage was a liquid rising. "What have you done?" His voice was quiet. That was worse than yelling. Rachel stripped her gloves without hurrying. T5 and T6 decompression laminectomy. He's breathing. Oxygen saturation 97. Sterling's hand was already pulling out his phone. She could hear him dialing as he walked into the hallway, his voice escalating into the receiver before anyone answered. "The hospital board president," he was saying, "emergency call, patient endangerment, unauthorized surgery by an unlicensed." Rachel documented everything. The procedure, the time, the outcome. Her hands entered every detail into the medical record with the clinical precision of someone who knew exactly what would come next. 14 minutes after she finished the incision, her badge would be taken. Within 6 hours, the state medical investigator would be reviewing every line she'd written. But right now, while the documentation was still hers to create, she made sure the record showed exactly what had happened and why. Tyler's toes moved at 0357. Not much, just a flutter of response, but his toes moved. Major Garrett saw it. He made a sound between a sob and a laugh, his hand going to his son's foot like he was making sure it was real. His foot, Garrett whispered. He can feel his foot. Rachel was pulling off her surgical gown when Sterling came back. He had his phone pressed to his ear, and behind him, she could see the resident who must have called him, Dr. Patterson, looking like a man who'd just made a very bad choice. Sterling disconnected the call. "Your credentials are being pulled," he said. "The hospital board is being notified. State medical investigators will be here by 9 o'clock. "Yes," Rachel said. "You don't have a medical license. You can't perform surgery." "You can't." He was losing the ability to structure his sentences, the rage starting to break through the careful professional tone. "You just destroyed a child's life if he gets infected. You exposed this hospital to catastrophic liability. You—" "His breathing," Rachel said. "His oxygen saturation is 97. His spinal cord is decompressed. His toes moved." Sterling's jaw clenched. For a moment, she thought he might hit her. Instead, he turned and walked out, talking into his phone again before he was even out the door. Chen was staring at Rachel. "What happens now?" "Now we extubate him in the morning when he's stable," Rachel said. "Now we monitor his progress. Now we hope his body does what it's supposed to do." "I meant for you." Rachel looked at Nurse Chen, at the woman who'd helped save an 8-year-old's life when every other adult in the hospital had decided it was impossible. "They're going to fire me," Rachel said. "Probably call security. Probably make sure I never work in another hospital. Worth it?" Rachel looked at Tyler. At his moving toes. At Major Garrett's hand trembling as it rested on his son's foot. "Yes," she said. "Worth it." Security arrived at 06 for 7 hours, when Tyler was stable and breathing better and his color had come back to something that looked like a child instead of a casualty. They escorted her down the main corridor of Mercy General where the early shift was just arriving, where nurses at the station watched her badge being taken, where 2 guards in polo shirts with security stitched on the back made it clear that she was no longer permitted on the property. She handed over her ID at the front desk. The plastic was still warm from her pocket. Her photograph on it showed a woman with tired eyes and a professional smile. The drive home took 22 minutes. She sat in her car in the driveway for 93 minutes without moving, her hand still smelling faintly of antiseptic, still remembering the shape of a child's spinal cord. Sophia found her at the kitchen table at 1,503 hours. 12 years old, still in her school uniform, her backpack on the floor, her eyes immediately understanding that something had changed. On the table in front of Rachel was a bottle of whiskey she hadn't opened in 6 years. The kind of bottle that represented every night she'd wanted to forget and hadn't. "Mom." Sophia's voice was very small. "Why are you home?" Rachel couldn't answer. She couldn't explain that doing the right thing had a cost that nobody paid except the people you loved. She couldn't explain that she'd spent 18 years running from her own name and now she'd lost her job trying to save someone else's son. Sophia wrapped her arms around her mother's shoulders, and Rachel cried, the kind of crying that belonged to a woman who had nowhere left to hide. Dr. Sterling's face was a shade of red that didn't appear naturally in human skin. His hand shook as he dialed, the hospital board president's personal line, the one he kept for emergencies, the one that had saved his career twice before. It was 03 for 7 hours. She answered on the second ring, her voice thick with sleep and irritation until Sterling started talking. He didn't whisper. He didn't need to. His voice carried the weight of a man watching his entire world collapse in real time. Rachel Torres had performed an unauthorized surgical procedure on a pediatric patient without attending physician approval, without anesthesia credentials, without a single protocol in place. A laminectomy. An emergency spinal decompression. In the ICU. At 3 in the morning. By 0500 hours, Sterling had made 7 phone calls. The board president. The medical director. His legal contact at Mercy General's insurance carrier. The state medical board's emergency line. Rachel's temp agency, where he left a voicemail that was all teeth and threat, unauthorized practice, patient safety violation, potential criminal negligence. The state investigator he knew personally answered on the third ring, still half asleep, and Sterling painted a picture so damaging that the investigator was already reaching for his briefcase before the call ended. Sterling stood in the empty hallway outside the pediatric ICU, his white coat perfectly pressed, his hair perfectly combed, and for the first time in his career, he looked absolutely terrified. Because he'd spent 15 years protecting Mercy General's liability profile. He'd never imagined the liability would be someone like her. Security found Rachel at 05:05, still in the ICU, charting vitals on Tyler, whose oxygen saturation had climbed to 97% and held steady. The boy was breathing on his own. His paralysis had halted. His mother was asleep in the chair beside his bed, her hand on his shoulder. Rachel didn't resist when the security officer approached. She didn't argue when they told her that her temporary credentials had been revoked effective immediately, that she was to surrender her badge and exit the building within 10 minutes. She didn't say anything at all. She just finished the last line in Tyler's chart, O2 sat stable, neuro exam progressing, and clipped her pen to her pocket. The security guard's hand hovered near her elbow, uncertain whether she needed to be escorted or whether she would simply comply. Rachel was already moving, already walking toward the exit as if she'd been waiting for this moment her entire career. The nurse anesthetist who'd assisted in the procedure watched from the medication room, her face pale as bone. "Rachel," she whispered, but Rachel was already gone. 3 days later, that nurse anesthetist would receive a call from a Navy SEAL commander asking about the procedure. 2 weeks after that, she'd be offered a position at Seattle General's Level 1 Trauma Center, and she'd accept, and she'd testify in the formal medical board review that every decision Rachel made had been clinically sound, medically necessary, and the only thing standing between that child and permanent respiratory failure. But in that moment, she could only watch Rachel disappear down the corridor, her temp badge no longer clipped to her scrubs, her ID number already being purged from the hospital system. The drive home was silent except for the rain. Portland rain. The kind that sounds like static, like the world is breaking down, like everything important is being washed away. Rachel's hands didn't grip the steering wheel. They rested there, loose and empty, the same hands that had held a child's spine steady while she decompressed the pressure that was killing him. She drove through 3 red lights without noticing. The city looked different now, smaller, as if she'd been living at a different scale than everyone else, and now she was being forced back down to their size. Her apartment was dark when she arrived. Sophia was asleep in her bedroom, her homework on the kitchen table where she'd left it, a geometry assignment that had nothing to do with the real angles of heartbreak. Rachel sat at that kitchen table in her scrub still damp with antiseptic and sweat. 2 hours had passed since security walked her out. 2 hours of driving in circles. 2 hours of existing in a body that didn't know how to be small anymore. The tears came without her permission, the kind of tears that belonged to a woman who'd spent 18 years running from her own name, 18 years believing that disappearing was the same as protecting the people she loved. She was still sitting there, staring at nothing, when Sophia shuffled out at 0630, rubbing her eyes, still in her school uniform from yesterday. "Mom." Sophia's voice shifted the moment she saw her. Kids are like that, they can smell when something fundamental has broken. "Why are you home? Are you sick?" Rachel couldn't speak. Her jaw was locked. The muscles in her shoulders had turned to stone. Sophia was 12, old enough to understand that there was something wrong, too young to understand that her entire world was about to shift again. The boxes in the closet. The way her mother always kept their affairs portable. The 3 different names on documents Sophia wasn't supposed to see. All of it had made a terrible kind of sense to the girl, and now, looking at her mother's face, Sophia was already doing the math. Moving. Again. Some new town, some new name, some new version of her mother who wasn't quite whole. "We need to talk about moving," Rachel said, and the words tasted like copper. "My job at the hospital, something happened. It's complicated." Sophia sat down across from her. She didn't ask questions. She'd learned a long time ago that some things didn't have answers. She just reached across the table and took her mother's hand, this girl with her father's eyes and her mother's terrible ability to survive. On the kitchen counter, behind the dish soap and the dried-out sponge, sat a bottle of whiskey. Maker's Mark. Unopened. Rachel had bought it 6 years ago during the worst night of her sobriety, the night she'd almost called her unit commander and asked to come back, asked to stop pretending to be a person and just accept what she was. A weapon. A tool. Something that functioned in the dark but couldn't exist in the light. She'd put that bottle on the counter and walked away from it, and it had sat there ever since, a monument to restraint, a prayer she made every time she saw it. She stared at it now while Sophia held her hand. The bottle represented something crucial, a choice she'd made about who she wanted to be. But choices don't matter when institutions don't want you to exist. Choices don't matter when the people protecting you are the same people trying to erase you. Rachel looked at her daughter and thought about Major Garrett's son, about how Tyler would probably walk again because someone had been willing to break every rule for him. She thought about how she'd been trained to make decisions under impossible pressure, and how none of that training prepared her for the moment when her own choices destroyed her. "Mom," Sophia said quietly. "What happened tonight?" Rachel pulled her daughter closer. She didn't answer. How could she explain that she'd saved a child's life by betraying the institution that had sheltered her? How could she explain that doing the right thing was the same as destroying herself? How could she tell a 12-year-old girl that sometimes the only way to protect people was to disappear? 3 days later, Major Garrett found the unit patch. It had been sewn into the lining of the jacket Rachel left behind in the doctor's lounge, a faded insignia from SEAL Team 3, Charlie Platoon, the kind of detail that only another operator would recognize. The patch was worn thin at the edges. The gold thread had tarnished. The way it was positioned inside the jacket, deep, deliberate, hidden, suggested it had been there for years, like a prayer no one was supposed to hear. Major Garrett, who'd spent 23 years in Special Forces, who knew exactly what that patch meant and exactly what kind of woman would carry it sewn into her clothes like a secret she was willing to die with, walked into the hospital administrator's office and demanded answers. He was still in his dress blues. His hands were steady. His voice, when he spoke, sounded like an order. "Why," he said, "is the only person who saved my son's life being destroyed by your system?" The administrator looked confused. Scared. Like a man suddenly understanding that he'd been making decisions about forces he didn't understand. And that was when Major Garrett realized that no one in this building had any idea who they'd just fired. Hit that like button if you appreciate the nurses and healthcare workers in your life. Drop a comment if you've ever worked in medicine or know someone who has. Subscribe and let's see what happens next.